I'm Jennifer. I am so excited to be talking with Dr. Jivraj, founder of Anacapa Dental Art Institute and creator of Anacapa Aesthetic Smiles. He's known as the Smile Transformation Innovator. A highly trained prosthodontist, he is also an author, educator, mentor, and internationally recognized expert in the dental field. Dr. J, I am so glad to have you here.
Thank you, Jennifer. I'm delighted to be here. Thank you for having me.
Let's talk more about your background. You have an incredible wealth of experience. Can you tell us more about that?
I went to dental school in the UK at the University of Manchester, which is a great dental school, and I practiced in London for quite a few years. But as a dentist, I just didn't feel I was in control of what I was doing, especially when patients came in which required comprehensive treatment needs. So I applied to the Herman Ostrow School of Dentistry for a program in prosthodontics, and I'll allude to what that is a little bit later because most people never know what a prosthodontist is. And I did a 3-year program, very rigorous program, probably the hardest 3 years of my life, 7 days a week, 14 hours a day for 3 years full time. And whilst I was doing that, I also completed a master's in medical education with a specialty in education, because my goal at that point was to be a full-time academic, because I love the academia side of things, but I also love the private practice. Today I'm fortunate I get to combine the two. I get to combine academics where I'm with students and residents, and also private practice where I get to see patients every single day and interact with different people all the time.
That sounds amazing. We mentioned earlier that you are an author. Can you tell us about your book?
We have written 2 editions of the same book. The first one was an overview in implant dentistry, and it was written in 2006, and the second edition just got released December 2024. I'm proud to say that it's been read by over 15,000 dentists worldwide. The second one was a little bit more on full arch implant procedures. And this is something that has developed over the last 10, 15 years. And there's really nothing out there that distilled all the information into a comprehensive resource. And once again, it's been read by many dentists worldwide, and many programs use it in their training.
That is so impressive. Now, for those who aren't familiar with your practice, what is a prosthodontist?
Prosthodontist, I explain that probably 5 times a day when patients come in to see me, because they walk in the door and they say, you're a dentist. I said, I am a dentist, but I'm also a prosthodontist. A prosthodontist is a recognized specialty by the American Dental Association. It's a 3-year full-time specialty, and we specialize in implant, cosmetic, and reconstructive dentistry. We fabricate dentures, partials, so we essentially do everything. I would almost go far as saying a super general dentist, with the additional training that we have.
That sounds like a lot of work, but it is clear you are at the top of your field. I'm curious, does everyone need a prosthodontist?
I wouldn't say everyone, but you can definitely benefit from a prosthodontist, because a prosthodontist would give you the additional years of training in the treatment they provide.
And who is the ideal patient for Anacapa Aesthetic Smiles?
I would say anybody missing teeth, right? Whether you're missing one tooth or you're missing a whole row of teeth, our expertise, prosthodontists, is prosthetic specialists. So anybody who's missing teeth, breaking down dentition, has undergone trauma, we provide comprehensive solutions for those types of patients.
You mentioned the Anacapa difference. What does that mean?
So the Anacapa difference, I remember a common adage which says, you can't do something 100% better, but you do 100 things 1% better. And I'm going to say the Anacapa difference is many small things. The first thing I would say is my team. My team is amazing. They've been handpicked to take care of our patients, and they do it with such grace and eloquence and empathy. Patients actually, even when they don't have a dental appointment, they come back to see us just to say hello. The second thing which I'm quite proud about of the Anacapa difference is we have a very experienced team of specialists. You don't have to travel anywhere. Today in the industry, one dentist will do one thing, they'll refer you to another specialist to do something else. We have everybody on site so that you can get taken care of. The third thing I would say we have is we have a team of dental laboratory technicians. We treat a lot of patients from out of town, a lot of CEOs who have very little time, and they want everything accomplished in a specific time frame. So we have technicians on standby that are able to customize their needs and be able to deliver things in a timely manner. All of those things together really culminate in, I would say, the Anacapa difference. And if you were to ask me, what can you improve? I say we're trying every day to improve something. So it's constant and never-ending improvement.
That is incredible. You mentioned having specialists in-house, you being one of them. Typically, if I visit the dentist and need something like a root canal, I might need to go to a specialist like an endodontist. But patients visiting your practice don't have to do that?
That's correct. When I first came into town and we developed the practice, we didn't have specialists on site, and we used to have to refer outside. And when you refer outside, you never know what that patient experience is going to be. So we wanted to control the entire patient experience, as well as know that the specialist that we're referring to is going to provide the absolute best they can provide. So we're fortunate enough today to have a team of specialists, an endodontist being a root canal specialist, a periodontist being a gum specialist, surgeons, anesthesiologists to put patients to sleep. Many patients don't like coming to the dentist, and I get it. And for us to be able to navigate that for them and tell them that, listen, you can have a lot of this dentistry done while you're asleep, it's huge for them. And to at least start the journey to fix their mouth and to fix their health. We also perform routine general dentistry, day-to-day stuff. It's important for patients to come to a place where they can have everything done and not have to go out. Unfortunately, 65% of the work that we do today is revision work, where patients have had something done elsewhere, and unfortunately for them, we have to replace it. Not a great feeling for a patient, but we try to make it as easy as possible for them.
I love that patients won't have to go anywhere else. They can go right to your practice and feel confident that they'll be taken care of. This is especially true for people with missing teeth, right? Patients can come into your practice and leave the same day with teeth that feel and function like a natural tooth.
Now, same-day teeth seems almost a miracle, right? If I told you that you're going to lose a front tooth and we were going to be able to restore you that very same day, and you walk out the door within an hour, hour and a half with a tooth, nobody would believe me, but it's a reality today. And today we see many patients that have multiple missing teeth, patients that have a terminal dentition, and they are going to get something which in the industry we call teeth in one day. And most patients, when they see that, it seems unbelievable, but it is possible, and we have solid science and research to show that it works. For patients, we remove teeth, we place dental implants, we provide them permanent teeth the very same day. Now, I must clarify, these permanent teeth are not their final teeth. There are a lot of implant centers out there that tell you that you're getting your permanent teeth within 24 hours. For me, that's impossible, because after the surgery, the gums have to heal, things have to change, and we have to work out the cosmetics, the bite, the function, and these are things that we have to do before we get to the final. But permanent teeth in a day is definitely possible, and I would say 60% of the work we do is exactly that.
That is such great information for patients to have. With that in mind, what can patients expect from your team?
So we explained the Anacapa difference before, and now I'm going to describe it from a clinical perspective. Now, there's a procedure out there called the all-on-4 procedure, and what the all-on-4 procedure is you have your teeth removed, 4 implants placed, bone removed, artificial pink gum put in, and you get permanent teeth the same day. Now, I have a problem with that procedure, and the problem that I have is if you have 4 implants and 1 fails, you can't have a full set of teeth on 3 implants. It's like a table with 4 legs. If you lose one, it's over. That table will definitely not be functional. Take an example on the screen. If you look at the example, the patient is, who's coming to see us, even in his initial preoperative photographs, he doesn't want to smile, he doesn't want to open his eyes. And you look at his smile after the procedure, he looks fantastic. What did we do for this gentleman? We didn't do the traditional all-on-4. We did the all-on-4 plus, whereby we placed 6 implants, but look, we preserved his own gum. Right? If you look at the graphic on your right, where you see that pink prosthetics, that is where the gum and the bone has been removed. And for me, that is way too aggressive. Whenever we're treating these types of patients, we're trying to preserve bone, we're trying to preserve biology. because no matter how good we are, the patient's health changes over time. And when their health changes and implants sometimes do fail, we still have to have the opportunity to be able to retreat them. If we do it the first way, we've lost that opportunity. The second thing that we do, which is very different, is we have advanced technology in the office. And this advanced technology really helps us deliver care in a timely manner. Once again, we're not relying on the technology, it's expertise-driven care, but we're using the technology as a tool to deliver the results quicker for you. We have intraoral scanners, we have face scanners, we have navigation-guided surgery where we have pinpoint precision when we're placing implants. And all of these factors together with expertise-driven care culminate in an amazing result for the patient that is going to last the patient a long time.
You know, I've seen a lot of implant centers popping up and advertisements promising patients their teeth the next day. What are your thoughts on this?
So I'm going to answer that question with a question. Imagine you had a little cut on your hand. Mm-hmm. That cut is going to scar, it's going to heal, the skin is going to change. Exactly the same happens in the mouth. You take teeth out, you place implants, there's going to be inflammation, the inflammation is going to change, the gum is going to shrink, and when it shrinks, there's going to be a space underneath your teeth. How is the patient going to live like that forever? For me, these corporate implant centers, with savvy marketing and the way they present this information to the public is very misleading. Same-day permanent teeth is possible, but they are prototype. Same-day permanent teeth forever in 24 hours is definitely not possible. So as a patient, it's a difficult choice. You don't know who to trust, you don't know who to choose. There are so many choices out there. Patients view savvy marketing and think, hey, I got to go to this person, or they view the lowest cost option and they go to that person. Lowest cost is not the best option because you're not getting the same result. The one thing I will say is don't go to a corporate implant center. They're really not interested in treating you. They're interested in your wallet. And unfortunately, it's a reality today where they overpromise and they underdeliver. If you're going to choose a place, go to a place where the dentist has a reputation, you can speak to their patients, you can see what the experience of others has been like, and somebody who's not just going to take care of you during the process, but also after the process. The sign of a good business or a good practice is what they do when things don't work out so well. And if they address your concerns immediately, that's the place you want to stay with.
Well, I have to ask, do implants last forever?
The real answer to that is no. Implants do not last forever. There's no medical device that I'm aware of that lasts forever. Take, for example, hip implants, knee replacements. They don't last forever. Physicians give us a timeline and they say this implant should last a certain period of time. Now, when we look at dental implants, they should last a long, long time. Based on good research, if they pass the first 5 years of service and they've been done well, they should last you for the rest of your days. And we do provide our patients with a warranty, providing that they come back for cleanings. If anybody says to you lifetime warranty, they probably know something that I don't. But we definitely try to take care of our patients, not just when we finish, but as we move forward so that we can help maintain what they have.
Tell us about one of your smile transformations with All-on-4 Plus. We can see them on the screen here with an amazing before and after picture. Wow. What was the process like for this patient?
So Mary Beth, it was quite a sad story for her. She had gone to a corporate implant center and she'd had implants placed and teeth put on the same day and final teeth put on the same day. And look at the shape of her face, look at her smile, look at the shape of her teeth. She was horrified when they gave her her end results, and they told her that was the best that they can do. She came to see us, we evaluated her utilizing our technology, and unfortunately for her, her implants were failing. And it surprises me that a corporate center could let the patient walk out the door like that. So she came to see us, and once again, we had to begin with the end in mind. We said, Mary Beth, what is it exactly that you want? What is it that you don't like about your current teeth? And she didn't like the appearance of her face. It made her look too old. The teeth were not bright enough. So we had to go back to square one, where we removed her existing implants, placed additional implants. We fitted her with something called prototypes, which was to communicate physically to her what she's going to look like. And if you look on the screen, Her smile is not just better, her face looks better. If you look at the lower third of her face, she looks way younger. She's got much more height. It almost looks like she's had plastic surgery done, but she hasn't. The height of her face looks a lot better, and she didn't have to go through that if she was diagnosed and planned correctly the first time round. It's sad for patients to have to go through things twice. And another case I'd like to talk about is Wanda. Wanda came to us a few years back, and she had what we call in the industry a terminal dentition. All that means is that all of your teeth are failing, and unfortunately they need to be removed. She was very specific in her requirements. She did not want to have removable teeth that came out of her mouth. She wanted her teeth to look as natural as possible. She'd been to a lot of implant centers where they told her that we're going to be cutting bone down and what have you. And for me, that wasn't the correct way to go. A lot of these centers, they treat patients one way. It's like if you have a hammer, everything you're going to see is a nail, and you can't treat human beings like that. Everybody has a specific, customized, individualized solution. So with Wanda, we did provide a customized solution for her. We were able to remove teeth. We were able to preserve bone. We were able to place implants and utilize our technology to give her teeth which actually felt like her natural teeth and solve all of her concerns with expertise-driven care. And Wanda is out now, 5-6 years on, and she's one of our biggest advocates. She tells everybody about us. I'm so happy to have helped her.
What a life-changing experience for them. I'm amazed more people don't know about this. Statistics show that more than 40 million Americans are wearing dentures. Why aren't more people doing this?
Isn't that an amazing statistics? Yeah. And I'll be the first to tell you that that's underreported. There's way more than that. Now, the reason most people don't do it is fear, cost, and they don't know it's possible. So let's start with they don't know that it's possible. Often these patients, they go to the dentist, and the dentist will automatically say, you don't have bone to do this procedure. And we do have bone. We just have to be creative in how the implants are placed. Now, from a cost perspective, there are numerous ways that we can help patients and be able to help them navigate their treatment needs. And from a fear perspective, the best thing I have found for patients is to put them in touch with other patients that have been through the process. And with our team of specialists and anesthesiologists, the patient is asleep through the entire procedure. They wake up with beautiful teeth in their mouth. What gets better than that?
This investment sounds worth it to me. Let's talk about the patients who come in and are very unhappy with how their smile looks. What can they expect?
So the first thing I will address is investment. So when you're having something like this done, it is a significant investment. And from a cost perspective, all patients are concerned about cost. My first question to the patient is, what is the cost to you for doing nothing? Imagine you live the next 25, 30, 40 years of your life just as you are. How is that going to impact your life? And I think patients stop and they think, that makes sense, and I got to do something to be able to change the situation I'm in. Now, what can we do differently? How do we approach it differently? As well as expertise-driven care, we leverage the technology we have and the laboratory technicians that we have to deliver a customized solution for every single patient. When we talk about Anacapa aesthetic smiles, you're not going to see two smiles that are the same, right? Every smile is going to be different. The smile is based on the patient's face. So we look at your cheekbones, we look at your eyes, we look at the shape of your chin, and we fabricate and design the teeth based on that. And we get you to try the teeth before we deliver the final so that you are 100% satisfied with what you're going to get.
I see you do prepless veneers. Can you go into detail about what that means and how that is done?
So prepless veneers essentially means that we don't touch the teeth at all. Traditionally with veneers, the dentist would prepare the tooth somewhat and make an impression or a scan and provide pieces of porcelain that are bonded onto the teeth. So preparation-less veneers are situations where we don't touch the teeth, and that's the best way to do it. Now, can that be done all the time? No, right? So if we can't do that, what is our next choice? Minimally invasive. So we try to touch the tooth as little as possible to be able to give the patient the cosmetic desires that they would like.
This sounds like a really unique approach that would be helpful for patients. What drives your decision making?
It's about technology and about tooth preservation. One of my pet peeves is when dentists call themselves cosmetic dentists. everything that we do should have an aesthetic or a cosmetic component. Today, it's about being minimally invasive, touching the tooth as little as possible. In days gone by, when part of your tooth broke, you'd go to the dentist would grind the whole tooth down and put a cap or a crown on it. Today, we don't do that. We preserve what you have and we bond directly to the tooth, so you get to keep 90% of your tooth intact. What is the benefit for the patient? There's a cost benefit, and the biggest benefit, you don't need a root canal. How good is that?
Yeah. I love that you say it's about confidence. Loving your smile can do wonders for self-esteem. We're looking at another beautiful smile. What was her experience?
So Lisa came in, very attractive lady. She was looking to improve her smile. She felt that her smile had aged somewhat, the teeth had worn down. She wanted longer teeth and brighter teeth and a wider smile. And we were able to do this with very minimally invasive techniques. Very little tooth structure was removed, which was an advantage for her. And we managed to do 10 veneers for her with some minor bleaching. And we were able to help her visualize the end result through digital imaging and physical prototypes, so she knew exactly what she was going to get. So on the day of delivery, when we were going to put the veneers in her mouth, there was no surprises. She knew exactly what she was going to get, and she was happy. She was ecstatic, and she's one of our biggest advocates.
Wow. Her smile is beautiful. I can see her confidence boost with her new smile, and you can actually show patients what their smile will look like before they even start. Can you tell me a little bit more about that?
Of course. So we do have technology that allows us to scan your face and digitally position the teeth in your face, so you have an approximate idea of how your smile is going to look. Now, I love that technology. It provides the patient a motivator to essentially see what they're going to look like at the end. However, if I was to say I was going to get digital technology and put a six-pack on me, maybe that six-pack is not going to be there. So that digital technology has to be followed up with expertise-driven care and what we call a physical prototype, which we can show the patient directly in their mouth. So we combine both of those to give the patient a really, really, really good idea of what they're going to look like at the end, and it works amazingly well.
It would give me such peace of mind to know exactly what to expect. Now, you mentioned that you helped patients who have botched dental work. You shared a shocking statistic that 65% of your work is revision work. Can you tell me a little bit more about that?
Unfortunately, I do see a lot of patients we are redoing things. And the reason that happens is the communication has not been clear. The patient doesn't know exactly what they're going to get at the end of the process. We take pride in really being crystal clear at the outset and setting realistic expectations for patients, and walking them through a process which is not just efficient, but which is very precise, so they will get exactly what they want. Now let me put you in a scenario. Imagine I'm going to be delivering veneers culminating in what you've been looking for, and I try them in and I give you a mirror and you look at them and say, I don't really like them. Usually in those types of situations, the patient feels pressured to have those veneers placed. We see a lot of those patients where we are replacing veneers where they've just had them done a month ago, right? Because they felt pressured by the dentist that, these veneers look great and how comes you don't like them? Bottom line is, it's the patient's teeth. It's their teeth. They're going to live with them. They have to love them. If I love them, it's great, but they have to love them even more. It's unfortunate, but yes, we do a lot of revision work, but we try to solve the problem in a very systematic way.
That's what's so remarkable about your practice. You work with other dental professionals. It's great that someone doesn't have to leave their current dentist to benefit from your expertise, and dentists can refer their patients to you. We're looking at a transformed smile here of a patient who had botched dental work. What was their experience with you?
Whenever I see this picture and I see the before and after, as much as it makes me happy, it makes me very sad. The story of this young lady, she came to see us about 14 years ago, and her dental requirements, she wanted to have a brighter smile, she wanted to have a nicer smile, feel more confident about herself, and we could have solved that very, very easily with some whitening, with some veneers, with some implants, and it would have been a very simple problem to solve. Unfortunately, she left state, went to Texas, where somebody convinced her not to spend the money on trying to save her teeth, and there was a solution out there where the teeth could be pulled and she could get teeth the same day, and everything would be great. Unfortunately, she went down that path, and what had been done was very far from ideal, should I say. So she came back to California, depressed, crying, and I still feel it today when I think about it. And I looked at her, and I wasn't going to say, "I told you so." I just wanted to move her forward and provide her with a solution where she's going to smile again. We had to start all over. Not had she lost all her upper teeth, which she didn't have to. We had to remove her existing implants. We had to start from scratch. And we took her through a process which gave her a predictable result at the end. If you look at the before and after pictures, the after result looks amazing. However, it didn't have to be that way. She would have been much better off keeping her teeth.
Her smile looks incredible. Now, I'm sure patients from all over the country would love to be in your chair. Do you work with out-of-town patients?
We have a lot of patients who come out of state and out of country. Our team takes care of every detail. We have local hotels where you can stay at. Once again, the advantage that we have is we have multiple specialists, technicians on site. So where it would take weeks and weeks and weeks to do procedures, we can do them in a very short space of time. Now we have CEOs who fly in from New York, and they need to be out within like 3-4 days, and we have to get everything accomplished during that time. So I'm blessed to be able to work with such a great team that can deliver efficient, precise, and predictable care.
You are changing the lives of so many people with Anacapa Aesthetic Smiles here at Anacapa Dental Art Institute. What are some of the life changes your patients have experienced?
So when patients come to see us, it's not about their teeth. They're looking for a solution for their life. They want to get married again. They want a new job. They want to travel the world. They want to go to the best restaurants. They can't do that if they don't have any teeth. So when they come to see us, we focus on the end result for them. And we take every single patient as an individual and very seriously. We do this day in, day out, but every day is special for me when I go to work. We help them with rebuilding that part of their life. So the biggest benefit is patients are able to smile more, and we take that for granted. But you don't know the value of something until you lose it. And they always say life is too short not to smile, so you have to be able to smile. Together with that, it opens up many things. You have improved relationships, and being able to eat whatever you want, being able to meet whomever you want, not having to hide your mouth in holiday photos. It does so many things for the patient that they don't even know yet when they're sitting in that chair. And it transforms their whole aura to positivity and makes them want to live life in a much better way.
It really is more than just about teeth. Dr. Jivraj, it has been an honor to speak with you. If you need a smile transformation, schedule a consultation with Dr. Jivraj, the Smile Transformation Innovator. Thank you, everyone.
Thank you for having me.